Chronic pain. Is it permanent and irreversible? A common misconception among patients and some clinicians is that chronic pain means that the patient has no effective treatment or management options, and that they just have to learn to live with the pain. Often, people don't know where to turn for help or get reliable information about the causes and relevant factors. Let's see some of them. Various factors other than structural damage or pathology can influence chronic pain. 1. Increased sensitivity of the nervous system can perpetuate pain beyond tissue healing. 2. Pain modulation may be altered. In other words, the body's ability to regulate nociception may be maladaptive. This may be related to changes in neuroimmune activity. 3. Anxiety, depression, or other comorbidities are likely to make it much more difficult to manage pain. If a patient has many issues besides pain that take up their energy and attention, they are likely to struggle with having enough resources to function normally. And 4. Lifestyle and behavioral factors such as poor sleep and inactive lifestyle or avoidance behaviors can negatively affect the impact that pain has on the patient's life. How can this knowledge be integrated into clinical practice? 1. Despite persistent pain, patient education on pain management may improve quality of life, general health, and physical capacity. 2. Encouraging and promoting movement, graded exposure, and self-efficacy might not remove pain, but it can improve how patients feel. In general, an active approach should be prioritized over passive therapies, even if treatment effects are the same, but only active treatments promoting physical activity have a positive impact on health. 3. Validating the patient's experience of pain and them as individuals is important. 4. Use clear, patient-centered language to explain pain, using layperson's terms, and avoid scientific terminology while considering the patient's context and lived experience. And 5. Use communication techniques such as asking open-ended questions, active listening, and tellback. Let's put it in practice. John, a 40-year-old male with chronic low back pain, believes his pain will never improve. He avoids movement and relies on pain medication. He finds it difficult to understand healthcare lingo and asks for simple, clear messages to ensure he understands them.
John, I understand your frustration. Can you share how you feel about your pain?
I don't think anything will help. My MRI showed disc degeneration.
What does disc degeneration mean to you?
I think it means that my back is getting old. Pain is inevitable, and I shouldn't, for example, pick up my kids.
Well, these findings are common, even in people without pain. Ongoing pain isn't always due to an injury or structural changes. In some cases, the body has difficulty returning to normal after pain has persisted for some time. This might cause an experience of pain even when there shouldn't be any. The good news is that, despite the pain, it's important and not dangerous to move and do the activities you love.
So it's all in my head?
Not at all. Your pain is real. But by gradually moving more over time, it's possible to help calm down this oversensitive nervous system and increase how much you can do whilst managing your pain.
To sum up, chronic pain is not a reliable indicator of tissue damage. Healthcare professionals can play a critical role in reshaping patients' beliefs through education, graded exposure, and self-management strategies. If a patient believes their pain is unmanageable, use simple and clear advice, reassurance, and approaches to help them regain an active role where they gain control over their pain.